What is meaning case study?
Patients, patient's condition
So
from
study about
starting.
patient. Okay. In theoretical some points for so apply on patient. That is a case study. Okay. Example, humerus. Okay. Theoretically study on parts. Okay, what are the parts? The humerus. Okay. Then first one is the upper end, lower end shaft. Okay. Upper end is also head of humerus. That is a neck, surgical neck of humerus. Then greater tubercle, lesser tubercle. Okay. Then neck. This is anatomical neck. This is surgical neck. This is anatomical neck. This is surgical neck. Okay. These parts are the upper end, upper or proximal end. Then in shaft, you place on the anterior surface is a smooth. Sorry, anterior surface is the mainly for tuberosity, deltoid tuberosity. The project is called as tuberosity. Okay. Then anteriorly placed on the capitulum and trochlea. Capitulum and trochlea. Then both condyle, medial and lateral condyle. Okay. Then in posterior is placed on the oblique fossa. Okay. Then this is for posterior surface, anterior surface. Okay. Then in the oblique fossa is joint formed. Okay, called as with joint. With joint formed oblique fossa. Elbow joint. Okay, elbow joint articulates this area. Okay. Then okay, in the how to side machine, first thing is the head. Head is placed on the medial. Head is placed on the medial. First point. Next point, in anterior side both capitulum trochlea is present. Okay. Posterior side we can fossa is present. Okay. Then shaft is a deltoid tuberosity is present. Okay. Then so this is anterior surface. Okay, anterior surface, head placed on the medial direction. Okay, correct. This is which side bone? Right side bone. Okay, whether it is same, ఇప్పుడు placed on this wrong. Okay, and posterior surface is the oblique fossa. Okay, this is wrong position. Correct position is the this for correct position. Okay, medially placed on humerus, head of humerus. Then deltoid tuberosity is anteriorly placed. Then capitulum trochlea is present on anterior direction. Okay, this is the side dimension of humerus bone. Okay, then in this humerus bone, what are the clinical parts? Okay, first one is dislocation. Okay, this humeral head is placed on the scapula glenoid cavity. This is called as glenoid cavity. So this glenoid cavity articulates with the head of humerus. Okay, in case any injury, okay, so forced fall from it. ஓகேங்களா இப்போ இப்படி ஹேண்ட் போய் புஷ் பண்ணி விடுவீங்க இல்லையா, இந்த மாதிரி இன்ஜுரியில் போயிட்டீங்கன்னா ஹெட் ஷுட் பி placed on this direction. This is for dislocation. ஓகேங்களா, the joint should be separated for bone. The two bones are attached called as joint. Okay, either one bone is a detached or detached to this other bone. This is called as dislocation. ஓகேங்களா, then other is subluxation. ஓகேங்களா, subluxation means partial dislocation. ஓகேங்களா, this dislocation is the fully detached bone. Subluxation means partial, only intact of this surface. Okay, our partial surface is only intact of the bone. This is called as subluxation. Okay, the second clinical anatomy. Okay, third one is the in a fracture of this part, fracture of this proximal of the parts. Okay, it is called as proximal humerus fracture. Yeah. Proximal humerus fracture na head fracture on head, neck, then tubercle. Yeah, these are all the proximal humerus fracture. Okay, then fracture on this area, fracture on this area called as shaft fracture. Okay, shaft fracture. Then fracture on this area called as lower end fracture, lower end of humerus fracture. Okay, in this humerus bone, typically children's common for condylar fracture, both condyle, medial and lateral epicondyle. This is what in children's common for this fracture. Okay, example, any sports injury. Okay, any sports injury, you fell down, it's keep on the hand should be this position. Okay, அப்படியே கீழே புஷ் இதாக உங்களை ஃபோர்ஸ் பண்ண முடியல, அப்போ என்ன ஆகும்னா this area should be fracture. Okay, that is called as supracondylar fracture. Supracondylar fracture. Supra means superior, upwards. Infra means inferior. So in this condyle, superior side fracture, so called as supracondylar fracture. Okay, is common for children. Okay, then in this bone, in this part, shaft is fracture for adult. Any adult common for shaft fracture. Okay, then high velocity force should be on the high velocity. Okay, so that force will act on the impact of shaft fracture. Okay, fracture should be patterns of derivation. Okay, fracture should be this direction. Either this direction, horizontal direction fracture happen, called as horizontal fracture. This direction fracture. Okay, only displaced on upper end and lower end. That is the horizontal fracture. Okay, then second type, fracture should be this direction, sideway. That is called oblique fracture. Okay, this direction fracture interact is called as oblique fracture. Okay, same also, same this direction spike or sharp fracture, no, there is spiral fracture. Oblique and spiral also both common. Oblique fracture and spiral fracture are common. Okay, this called as oblique means entire this bone separation. Spiral means it's the end bone should be a spike. Okay, this is spiral fracture. Then transverse means divide into upper and lower part. Okay, called as this is a pattern of fracture. Okay, then in proximal end called as part fracture. Parts mean 1 part, 2 part, 3 part. Okay, fracture occurs only greater tubercle, called as 1 part fracture. Okay, the fracture should be greater tubercle and surgical neck. Two fractures called as 2 part fracture. Then fracture should be greater tubercle, surgical neck and head of humerus. Both 3 parts should be displaced, called as 3 part fracture. Okay, then fracture should be both tubercle, surgical neck and head of humerus. Okay, all the parts should be fracture, called as 4 part fracture. Okay, proximate should be classified 4: 1 part, 2 part, 3 part and 4 part. Okay, then lower end common for supracondylar fracture in children's. Shaft is mainly for high velocity injury. Injury should act on the high velocity force. Okay, then mainly for pattern, transverse fracture, oblique fracture, spiral fracture. Then only transverse, oblique and spiral. Okay, any doubts? These are the humerus bone clinical anatomy. Okay, then in the scapula bone is also called as flat bone. Scapula, this is the long bone. Okay, scapula bone is also called as flat bone. Okay, this flat bone in any condition is rare. Okay, so placed on the posterior direction. Okay, so placed on posterior direction. So most of the humerus, clavicle is one of the most common fracture. Scapula is the uncommon and is securely placed on posterior. In impact on more high velocity more high velocity force act on this body, that time only fracture happen. Okay, this bone fracture only act on the conservative management, not need for surgical management. Okay, then most common fracture for the body. This is the body of fracture. This part only fracture. Okay, any high velocity force happen, that body should be on the crack on this either direction. Okay, then so also called as the humeral articulation. The articulation means the glenoid ligament. Glenoid ligament. The glenoid cavity articulates the head of humerus. Okay, then the joint should be stabilized on the what structure? Joint should be stabilized. More common for structure. How to stabilize? How to stabilize the joint? Ligaments. Oh, ligaments should be stabilize the joint.